traveling in and outside the loop from Memorial to the Medical Center, giving you the money tips you need to help pad your purse. From the control room of Channel 11, in front of a live studio audience, it's Great Day Houston. And now, your host, Deborah Duncan.
Before we went to break, we said it can feel like everything from a sharp pain in your chest to having something caught in your throat. Think you know what it is that we're talking about? Well, maybe this will help.
I can't believe I ate that whole thing.
No, Ralph, I ate it.
I can't believe I ate that whole thing.
Take 2 Alka-Seltzer.
Plop, plop, fizz, fizz. What is he suffering from along with millions of other people? Acid reflux or heartburn. Sometimes over-the-counter medications can help, but other times the symptoms won't go away. And here to explain ways to avoid acid reflux and ways to treat it, please welcome back Dr. Todd Wood from Memorial Hermann and his patient, Linda O'Leary. Hi there. So Linda, you know, I think all of us have had heartburn at some point, but you got to the point where this was just something that was almost, you know, knocked you on your knees.
It really did. I'm a mom and I'm active, I work, and it was completely consuming my life.
Yeah, had it always been that way or had it gotten worse over the years?
No, I battled with it for about 8 years, and initially the meds worked, and then even with all the meds and increasing them, it stopped working.
Yeah, I described it as it could almost be something like driving a stake through someone's chest.
That was me.
Wow. Okay, so Dr. Wood, I think we can get an idea of how many people are dealing with something when we see all the commercials on the air for every medication that there is. Lots of over-the-counter medications. She mentioned that she started using that. Do they work?
For most people, they do. You should start, of course, don't jump straight to medicine. Start with diet and lifestyle changes. Smaller meals, most people have to sleep propped up on pillows to help combat the symptoms. When that's no longer enough, you should consider seeing your doctor. We can start with several classes of medicines. Most of them work. Sometimes they will work for a while and then unfortunately not quite as much.
Yeah.
And there is a natural progression. Sometimes as a surgeon you will come and see me. That's generally more at the end of the progression, however.
Right. Okay, let's start with what is happening in the body that causes that level of pain, and then how do the medicines help to treat it?
Well, there is a valve between the esophagus and the stomach that should stay closed and prevent acid from refluxing back up into the esophagus. When that mechanism doesn't work, then the stomach acid can come up, irritate your esophagus, and give you the classic heartburn type symptoms. Other people will have more atypical symptoms. Instead of that burning chest pain, it may be irritation in the upper airway, which can give you a cough, recurrent bronchitis, recurrent pneumonia.
Yeah, and this is one of those things that if left untreated, it's not only uncomfortable, but can move into something more deep.
It actually, if left untreated, in some people can progress on to esophageal cancer.
Okay, you touched on a couple of things of like how to sleep, diet changes. You did a lot of this stuff. You would sleep sitting up?
Yes, I would sleep in chairs sometimes.
And still wasn't working for you. Okay, what are some of the other things, before we get to what her answer finally was, some of the other things that people can do to help eliminate the symptoms?
Well, like the gentleman on the commercial, don't eat too much. If you eat large meals, there are certain foods that are known to do it. The classic is going to be the chili dog with extra onions. That gets just about everybody.
Yeah.
But if you eat meals, avoid the bad foods, don't eat right before lying down. In a lot of cases, that'll be enough to help with the symptoms.
Yeah, but for Linda, that was not enough. And so what eventually ended up working for her?
Well, she had already gone through the progression of the various medicines and was at the point where the medicines were not working. So she was referred to me, and we were able to talk about the surgical options.
Yeah, okay, when somebody says surgery, you have to stop and think about that. As much as you were suffering, a lot of us just are trained in our head to go, okay, surgery. So, in fact, it had been suggested to you once before, had it not?
4 years ago.
Yeah.
And when I heard about it, I said, absolutely not. I'm not doing that. You're not going to cut me open. I'm not doing that. And then I had to do something. It was that bad.
And then, of course, there are different types of surgeries, Dr. Wood. So,
yes.
So exactly what did you do to make the difference here?
Well, as you said, we have basically 2 general options. One is the more traditional surgery. We do it laparoscopically, so through the tiny little incisions, and we go and take the top part of the stomach, wrap it around the esophagus. That reestablishes the strength of that valve, and it helps prevent reflux.
Yeah. And when you say laparoscopic, for people who don't know what that is, that makes things so much, healing times much quicker.
Some people call it keyhole surgery or minimally invasive surgery.
No big scars.
The incisions are generally about less than an inch. For this operation, there may be 4 of them. Overnight hospital stay, a little bit of discomfort, but not too much.
Yeah. All right, and then is that exactly the one that you did on her, or was it something else?
No, actually, there's a new procedure out. It's been out for 4 to 5 years now. It's just recently made it to the Houston market, and it's called a TIF procedure, TIF, transoral incisionless fundoplication. So you get a similar result without having to put in incisions on the abdomen, no cuts. It's all actually done through the mouth.
So acid reflux had taken over your life. Now you truly have your life back. How soon before you started noticing that I can sleep through the night? I can
Immediately.
Eat? Wow.
I mean, a week of recovery, and it's completely different. Those pains and those the discomfort I had every day of my life, I have not had.
Yeah, it's one of those things where you say, why did I not do this a long time ago? But the important thing is you finally decided to do it, and you're sharing your story with other people because, as we know, millions of people are suffering with this, and this might be the answer for them. For more information on Dr. Wood and the new surgery for acid reflux, go to memorialhermann.org or call this number, 713-456-HBRN. That works out to be 713-456-4276. Thank you very much for explaining this to us.
Thank you.